It's time for the Dr. Cho Show, the show that helps you understand the latest and safest modern dental techniques for you and your family. You'll become an educated dental consumer and also learn about health trends outside of the dental industry. Here's your host, Dr. Dan Cho.
Hello everybody, welcome to the Dr. Cho Show, your number one resource for everything related to your oral health. My name is Dr. Dan, and what I wanted to talk about today is different levels of sedation, which is going to be, and I should also say that different states will define ones versus different a little bit differently, but this is kind of generally how it is. So there's minimal sedation, moderate sedation, which is the level of sedation that is pretty adequate for most people, deep sedation, and then general anesthesia. So going back to it, minimal sedation, what it basically is, the name implies, it's a minimal amount of depression of the level of consciousness while still producing endolysis. So patients during this are able to respond normally. They can speak normally, respond to verbal commands, and basically can talk. So this is where somebody is able to understand, they're awake, they're conscious, they are aware of what's happening, but they're a lot less anxious. The level of anxiety is kind of reduced this visit. This is for somebody who just needs a little bit, if you got a little bit of anxiety, but they can basically, muster through it. And the most common pharmacological agent that's used is nitrous oxide, also known as laughing gas. Nitrous is a very, very, very safe medication, has a lot of really great major advantages. You can titrate up, you can titrate down to the effect. It comes off really, really quickly, comes on really, really quickly as well. But the biggest thing for most people is that you do not actually need, in the state of Oregon, you do not need to have a separate form of transportation, whereas everything deeper than this you do. This means that you can drive yourself to and from the appointment, which is very, very, very convenient for most people. Really, if you start to go to moderate and deep, then you actually do need to have somebody, drive you to and from. So the vitals are, they're monitored, not crazy as much as it is with a moderate, deep, and obviously general anesthesia, because patients are able to independently and continuously maintain their own airway and ventilatory and cardiovascular functions. It works really, really well, but for somebody who has a really, really, really deep-seated fear of the dentist, it's not enough. So you have to go to kind of the next bump, which is going to be moderate sedation. So this is the level of sedation that's typically referred to when somebody says, I got to be knocked out. This level of sedation intentionally depresses the consciousness to where, somebody is able to purposefully respond to verbal commands. They will respond to tactile stimulation. If you get tapped on the shoulder, say, hey, Mr. Jones, how you doing? They'll respond. And the most important part is there's no interventions that need to be done to maintain the airway and or cardiovascular system, and independent spontaneous ventilation occurs, meaning the patient, you can breathe by yourself. You don't have to have a machine help you. You don't have to be intubated. None of that. It doesn't have to happen. Patients are very, very, very closely monitored to make sure that there's no danger to the health, and to also make sure that they don't get pushed into anything that's deeper than moderate. And so the thing about this is patients are conscious, but most often a very, very, very common drug that's used is something called Medazilla, which is a very powerful anesthetic effect, which, kind of really stops the ability to convert short-term to long-term memory. So this is why somebody, especially if they fall asleep, they won't remember it, because this medication will actually make them not remember it. So because they don't have any memory of the appointment, they think, oh, hey, I was knocked out, I was unconscious. But no, they're still conscious, but they just can't remember it. So that's something that is to be kind of very, very, very clear about, because I have had some patients who said, I don't care, I have to be put to sleep, I have to. And then, so if that's talking about deep or general anesthesia, which typically needs to go to a specialist, a dental anesthesiologist. And so there also are a little bit more prerequisites for moderate sedation, which I'll get into some of them, but like I mentioned before, the biggest one is the need for separate transportation. You have to have somebody drive you to and from the office, and that driver has to have a vested interest in your well-being, meaning that you can't Uber, you can't get a taxi or anything like that. You got to have somebody come and drive you, who's going to be responsible to take a look after you, because after recovery you can still walk, you can still talk, or you're still the effects of the drug still last for up to about a day or so. So you'll want to kind of take the rest of the day kind of really nice and easy, and make sure that somebody can keep an eye on you. So those two, minimal and moderate, the patient is still conscious, the patient can still breathe, can still maintain airway and cardiovascular function normally, and still awake. Now, the next step, deep and general anesthesia, I'm going to kind of pair them together, because during these times is when somebody is now unconscious. The level of sedation has depressed their consciousness severely enough to where the patient is not easily aroused except through painful stimuli. So if you tap them on the shoulder, they won't respond. You okay? How you doing? They won't say anything. If you cut open their leg, or during a surgery, though, during deep sedation, they will respond to that. And so another kind of really critical thing is that the patient may not be able to independently maintain their airway, and ventilatory function may also be impaired as well. And while cardiovascular function is usually maintained, sometimes it can need a little bit of help as well. What all that basically means is that under deep sedation, and absolutely under GA, general anesthesia, under deep sedation, somebody may not actually be able to breathe by themselves. And so this is where the level of care typically needs to be, if you're intentionally being pushed into deep sedation, you need to be intubated. There are a little bit more training, a little bit more equipment and things like that need to be maintained. But this is the part where someone says, I got to be knocked out, doc. If you're going to be taking out that tooth, this is at the minimum of where you need to go. General anesthesia is, most people are kind of really familiar with general anesthesia. It's the level of sedation that the patient is truly unconscious, truly asleep, and that the patient does not respond to painful stimuli. This is the type of level of sedation that's required for heart surgery, for joint replacements, typically those sorts of things, because it would be kind of difficult for a surgeon if the patient kept on moving every time that they would make an incision or this or that. And so those are kind of the four levels. And something really, really important concept is that sedation is always going to be on a continuum. So somebody can go from minimum to moderate, and then most importantly from moderate to deep, and then back from deep to moderate actually really easily. Because of this, every single provider needs to be prepared to be able to treat one level deeper than their intended level of sedation. So all moderate sedation providers are trained and capable of rescuing a patient who is unintentionally pushed beyond moderate into deep sedation, because again, that's where they all become unconscious. It's very, 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 very important to make sure that you are really well trained, because at the end of the day, the most important thing is patient safety. Don't want to have any adverse events. We want to make sure that the patient survives. We don't want to end up with anything bad happening. And so it's very, very, very critical that everybody, patient, doc, everybody understands and has protocols in place to understand, hey, this is kind of the sequence of events. And so, like I had said at the very beginning, if you're stuck with me over here to the end, I'll tell you how to get a free consultation for it, and possibly get some free dental sedation. So that is really just, again, contact my office, get a hold of me. My office phone number is 503-646-4600. You can give us a call, and another way you can do is you can email us at info at lifebloomdental.com. That's LIFEBLOOM dental dental.com, EBLOOM dental.com, or you can also go to our website, which is going to be portlandsdentist.com. That's Portland with an S, portlandsdentist.com. You can look me up and all that other good stuff. And so, and the reason why I say that possibly get it for free is that I actually don't charge. At least I don't charge for dental sedation. Is something where I have a current passion for it. Is something where I would like to be able to help as many people as possible. And for this aspect, I just enjoy it. And so, if you want to hear about any of that, if you want to have a quick chat, if you have any questions about any of that, get a hold of us, and we can figure out a time to figure out how if sedation is right for you. So really, outside of that, if you do have any
Thank you for listening to The Dr. Cho Show. If you have any questions for Dr. Cho, you can reach him at www.portlandsdentist.com or by calling his office at 503-646-4600. Or feel free to send him an email at info@lifebloomdental.com.